This article deals with the HITECH Act, the changes in HIPAA law in 2010. Physicians and other healthcare providers who utilize electronic health record systems will have to comply with updated HIPAA privacy and security rules as early as 2011 under a proposed rule published by the Health and Human Services Office for Civil Rights on July 14, 2010. The rule implements the 2009 Health Information Technology for Economic and Clinical Health Act, that's the HITECH Act provisions, aimed at creating a secure foundation for sharing electronic protected health information in the emerging landscape of healthcare reform. The HITECH Act strengthened and expanded the scope of the HIPAA privacy and security rules, enhanced the HIPAA penalty provisions, provided for HIPAA enforcement by state attorneys general, and established a federal data breach notification law. The heightened safeguards and compliance requirements, along with increased penalties for non-compliance, pose significant hurdles not only for existing covered entities, but also for a significant number of additional organizations in the healthcare industry. The HIPAA privacy, security, and enforcement law changes involve covered entities, that's physicians and hospitals, and their business associates, both of whom must comply with the language of the HITECH Act. The changes include the following. Number one, access to electronic health records. Covered entities that use electronic health records must provide patients with a copy upon request. They can charge a reasonable fee for complying with the request, such as a copy labor costs. Number two, minimum necessary rule. Covered entities are required to use or disclose only the minimum necessary amount of protected health information required to complete a covered function. That is, use a limited data set or the least amount of protected health information necessary to accomplish the intended purpose. Number three, business associate agreements. Previously, business associates were required to comply with HIPAA-related privacy laws through a contract with a covered entity, but they were not responsible for HIPAA compliance. Now, business associates are bound by the HIPAA laws and must have policies and procedures documenting the same. Specifically, they must amend their business associate agreements to add language that the business associate must comply with the HIPAA rules, including the breach notification requirements, and include details on how the business associate will restore and safeguard protected health information. Number four, request for restrictions. Covered entities must allow individuals to request restrictions on how their protected health information may be disclosed, but are not required to honor such requests. For example, a patient who pays out of pocket can request that his health care provider not disclose information about his medical condition or treatment to his employer or insurer. Under the old privacy laws, a covered entity was required to accept the patient's request, but did not have to act upon it. Effective 2010, however, covered entities must honor requests not to disclose protected health information for purposes of payment or healthcare operations only, if the patient pays the entire cost of treatment out of pocket. Number five, marketing, fundraising, communications. Currently, in 2010, covered entities may not engage in marketing activities that use a patient's protective health information without authorization. However, an exception exists whereby covered entities and their business associates can encourage patients to purchase or use a health-related product or services without authorization. For example, a cardiologist can send materials to his patients encouraging them to use a certain cholesterol-reducing drug. This exception applies even if the covered entity is paid by a third party, that is, the drug manufacturer, to engage in such marketing. Under HITECH, such activities are still permitted, but with additional limitations. Specifically, the marketing communication must A. describe a healthcare-related product or service that is provided by or included in the plan of benefits of the covered entity making the communication. That is, an insurance company cannot market a drug that is not covered. B. relate to the treatment of the individual. And C. relate either to the case management or care coordination for the individual or to the recommendation of alternate treatments or providers. Additionally, covered entities can continue to receive payments in exchange for these communications, but the communications must relate to a drug that the patient is currently prescribed, and the payment must be reasonable.